Hello friends, I am Shumashu Sahu and I am back with my second video on my YouTube channel KGM Knowledge Kena Medico. First of all, I would like to give a huge thanks to all my viewers for giving such an amazing response about my previous video. This has really boosted my confidence and created an ecstatic movement to continue my academic journey on the YouTube. Thank you so much guys. In this particular video, I will be talking about the KDT, which is in textbook for the pharma, as well as the way of studying KDT, as well as the writing technique in the university exams. So friends, this KDT is one of the most commonly used book, with such an amazing book written in a student friendly way, easy to understand, and it's an usually written in a easily understandable language. So it has total 13 sections, which mainly compromises about the intro, about the general pharmacological principles, drug acting on the ANS, drug acting on the CNS, drug acting on the PNS, cardiovascular, drugs acting on the cardiovascular system, renal system, GI, gastrointestinal system, blood formation, and the drugs affecting the mainly blood, anti-microbials, and drugs for the neoplasia. So if you are just a student entered in the second prof of MBBS course, and started studying the pharma, one point you have to always keep in mind, that you have to learn all the classification in your tips. Classification will really help you to excel in the subject, as it is most commonly asked in the university paper. Describe the classification of that particular drug. Along with it, if you have a classification tips, you can easily categorize the drugs that is been asked in the paper. It is really going to be the most efficacious way of topping or excelling in the pharma subject. Along with it, if you are just starting to study any particular topic in the subject, the following points you have to keep in your mind while studying a particular drug. Firstly, if you are studying a drug, you have to understand its intro, where means to which category that particular drug belongs to, which its chemical composition, if any unique feature about the drug is present, or whether it is a drug of choice for any illness or any disease. Firstly. Secondly, you have to understand its pharmacokinetics, the mode of administration, the route of administration, its efficacy in the oral, if its efficacy for the oral route. Thirdly, the enzyme metabolizing it, the route of its excretion, why it's renal or why it's sweat. Okay, then then you have to also explain the enzyme, its metabolism, if it is excreted unchanged or it's excreted by metabolizing by the liver enzymes. Now thirdly, you have to understand its mechanism of action. Molecular mechanism has to be understood very well. And fourthly, you have to give the uses, whether it's a drug of choice for the particular illness or all the other uses of that particular mentioned drug. Fifthly, you have to give the ADR, adverse drug reaction which mainly compromises of the side effect which any syndrome it is causing. Okay, fifth point. Sixthly, you have to understand its interaction. If any person or patient is having a severe illness, then a various number of drugs has been given to it. There might be a possibility of having interaction between these drugs, which may interfere with one other efficacy. So the physician or the clinician has to be very very mindfully. They have to give such drugs so that there will be least interaction between that two particular drug. Seventhly, you have to give the contraindication, the condition under which these particular drugs are contraindicated, as they may deteriorate the patient conditions. And lastly, you may also give if particularly specifically about the antimicrobials, you have to explain or you have to learn the mechanism of resistance via which the microorganisms have resistance for the antimicrobials. So these are the following points. Okay, now like we have seen, like I have said, that if the particular question has been asked about particular drug in the examination, you have to describe that particular drug under following 8 points that I have discussed previously in the few back moments. The firstly, you have to give the intro about the drug. Okay, now pharmacokinetic. Thirdly, mechanism of action. Fourth, the uses of that particular drug. Fifth, ADR, adverse drug reaction, that compromises of the side effect syndromes it causes. Sixthly, interaction. 7, contraindication, the conditions where that particular drug is contraindicated. And finally, 8 is the mechanism of resistance developed. This point is basically specific to the antimicrobials antimicrobials. Okay, so this is the way of reading any drug. This is the way of writing that particular drug in the examination hall. So I will so in the KDT we look at the most important chapter among them is the cardiovascular drugs, which mainly compromises about the drugs related to heart failure, anti-arrhythmic drugs, anti-hypertensive, the most important topic, anti-hypertensive. Similarly, the classification of anti-hypertensive is asked frequently. Similarly, the antimicrobial drug asked to are also important, and central nervous drugs acting on the central nervous system are also important. So in this way you can excel in the pharma subject. Always remember 8 points that I have discussed. Always try to study any drugs in that 8 particular point. It will surely create and make this pharma subject interesting. And also keep one point always in your mind that this is the most volatile subject of the second year. So you have to revise that particular subject frequently. Okay, now one of the best thing that I have seen in the YouTube when I was started my second year journey is that some YouTuber has advised me that we should write the classification of that particular drug in the paper and stick it to the wall, and in the morning or when you wake up or when you're going to sleep, see that particular classification. This will really going to help you to memorize that classification of that particular category of the drug. This is one of the most efficient way of learning the pharma. Okay, and also always and also try to make a small yellow slips that contains the fact or any adverse effect that like Redmond syndrome associated with the vancomycin and other types of the adverse reaction that may come for the 1 marks question. Thank you guys. This is all about my detail or my discussion about the pharma subject KDT. I hope you will understand this content, and if you like my content, please do like, subscribe my channel, like my video, share my video, and thank you so much for listening me patiently. Thank you.